Welcome, everyone. My name is Julia Coburn. I'm the Member Engagement and Events Coordinator for Community-Based Research Canada and the moderator for today's session. Today, in our final event of the Moving the Dial series, highlighting action-oriented community-based research, we will learn from Dr. Charmaine Williams and Joelle Forbes about a research project that has moved the dial and support for families affected by mental illness. This presentation is brought to you by CBRCanada. I'm joining to you today from Waterloo, Ontario, where the CBRCanada Secretariat is located. We are situated on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Community-Based Research Canada is a membership-based nonprofit organization with over 60 organizational members, including community organizations and academic institutions, as well as individual members. Our mission is to advance community-based research excellence in Canada by bridging capacities, facilitating connections, mobilizing knowledge, and championing community-based research. As part of our programs, we host events, including webinars like today's events, as well as monthly communities of practice. You can find out more information on our upcoming events, as well as recordings and graphics from past events, all on our website. In the spirit of truth and reconciliation, we open each e-learning event by reflecting on and amplifying the goals of the Truth and Reconciliation Commission's calls to action. This month, we're discussing a research project involving support for families affected by mental illness. Fitting with this theme, today we've chosen to highlight call to action number 21, which states, we call upon the federal government to provide sustainable funding for existing and new Aboriginal healing centers to address the physical, mental, emotional, and spiritual harms caused by residential schools, and to ensure that the funding for healing centers in Nunavut and Northwest Territories is a priority. CBRCanada is committed to the continual reflection and interconnections between truth and reconciliation and various topics we approach using community-based research, and to engaging with and learning from diverse First Nations, Métis, and Inuit peoples across Canada. Shortly, I'm going to pass things over to today's speakers to begin their presentation. Following the presentation, we'll have a short 15 to 20 minute question and answer period with the presenters. And I encourage you to type your questions into the chat as the presentation is, throughout the presentation and as the questions arise. So during the presentation, I'll scan your questions and we'll aim to address as many as possible. We ask that participants keep their microphones muted throughout the event to prevent any background noise. You'll be receiving a notification when I begin the recording, but also we want to reiterate that today's event is being recorded and will be available, as well as the slide deck on our website. So without further ado, I'm honored to be introducing today's panelists, Dr. Charmaine Williams and Joelle Forbes. Charmaine Williams is Dean and Professor at the Dr. Amantosh Faculty of Social Work at the University of Toronto. Her research bridges practice in access and equity issues that affects various populations, including racial minority women, LGBTQ individuals in local and international contexts, and individuals and families affected by serious and persistent mental illness. The majority of her practice experience has been as a clinician in the mental health care system. She has also been involved in organizational change initiatives in the healthcare sector and has extensive experience developing and delivering professional education in the areas of anti-racism, cultural competence, mental health, and addictions. Joelle Forbes is a social worker and psychotherapist registered with the Ontario College of Social Workers and Social Service Workers. She is also a sessional lecturer at the Dr. Amantosh Faculty of Social Work at the University of Toronto and the co-founder of Hope Leads Mental Health Care. She has spent many years providing mental health care in various settings, including a community health center, hospitals, and private practices. She holds a BA in bioethics and Master's of Social Work degree from the University of Toronto, and has also received training in cognitive behavioral therapy, dialectical behavioral therapy, acceptance and commitment therapy, narrative therapy, and motivational interviewing. Her practice philosophy reaffirms the importance of empowering communities addressing the social determinants of health and honoring intersecting identities, and engaging in anti-oppressive and anti-racist practices. Further, she has provided clinical supervision and training to master's level social work students and peer counselors. Joelle has co-authored multiple peer-reviewed articles and book chapters in topics such as Afrocentric, clinical practice, mental health, community care, spirituality, and LGBT human rights. So now I'm going to pass things over to our wonderful panelists and allow them to introduce themselves and their organization. So welcome, Charmaine and Joelle.
Thank you so much. I'm going to get the presentation up on the screen. There. So I'm hoping that I don't see any of you anymore. So I'm hoping that you can see the presentation now. Yes?
Not yet. Quite
Not
yet.
Not yet. Okay.
Oh, now it's loading.
Okay, good. There's always that moment of uncertainty for me. So yes, I'm Charmaine Williams, and you got a lot of who I am in the introduction already, so thank you so much for that. Joelle and I are presenting on behalf of a project that involved many more people, and I do want to make special mention of a couple of them that are here with us right now. So Jenna Rines, our research coordinator, is here, and I'm also very happy to see Stuart Clarefield, who you'll be hearing about a part of the project he was involved with, and he was part of the project team as well. So I don't know that I have much more to say by way of introduction of myself. I'll pass over to Joelle if she wants to say anything.
Of course, of course. So hello, everyone. My name is Joelle, and I've had the great pleasure and privilege of being part of different phases of this project, from the beginning of the planning stages, recruitment, building those community connections, knowledge translation. It's been a true pleasure to be part of this journey. And one thing I want folks to really take away as we're having this discussion today is, how did we facilitate community care and community connections throughout these phases? Because this was a big value that showed up for all of us on the team.
Thank you, Joelle.
I just wanted to mention, Charmaine, that the presenter view is involved. Do you have a second screen that you could share? I can also share the slides as well.
You know, let me just see here. So, oh yeah, okay, so that's what it's showing. So I'm going to come out and I'm going to try again.
It seems good. Better.
Okay, good. I remember I did that once, and I put so many notes in the bottom, and I was like, oh, now they're going to know I don't speak in that flowing way. Okay. So I'm going to take it to our first slide. So we're talking about a project today that we have come to call the Family Caregiving Project, but it started as a SHRC grant, and I should have put that on here because it wouldn't have been possible without funding from the Social Sciences and Humanity Research Council of Canada. And the project has three components. One that you're going to be hearing a lot about today is a series of what we call family mental health cafe experiences that were held in Ontario, different cities in Ontario between 2018 and 2019. And then there was also an online survey of caregiving families, and then a third phase that was in-depth interviews with families. And to sort of give you an overview of what was driving the project, I had these research questions that were about the issue of caregiving and how families were navigating that. And I think that part of what, the hook that I brought to SHRC was, we're in an environment where chronic illness is on the rise. More and more people are identifying as being affected by chronic illness, and certainly mental illness, we're talking about serious and persistent mental illness, is a chronic illness. As well as many people who have those illnesses have mental health issues. And yet I felt that the models that we were using to support families did not reflect contemporary understandings of family. So it was very much built in a sort of nuclear family model, an assumption that there was a woman caregiver, usually a parent, who was bearing what was literally called the burden of caregiving, and that the people diagnosed with mental illness in those families were mostly sort of put into this box called patient, stressor, these kinds of things. And then also that that nuclear family presentation didn't take into account the diversity of family forms. So I really felt there was a need to find different ways of understanding families based on contemporary understanding of families, but also on a contemporary understanding that people who are diagnosed with mental illness are not, that is not the entirety of their identity, and being disabled by mental illness is not the entirety of their lives. So the research questions were, designed, this first one, to find out just about how families talked about caring and caregiving. So what does it mean, giving, receiving, sharing, and exchanging care over the lifetime of a family, in a family that's affected by long-term, unpredictable chronic illness, and in this case, mental illness? And secondly, how do the meanings that people attribute to that connect with the identity that the family has and the role that they're able to play in society? Because of course, people are living this experience in the context of a society where we don't talk a lot about mental illness, where there is stigma against mental illness. So how is that something that they navigate as well? And then also thinking in terms of services and responses, institutional responses, what can we learn from caregiving families that will teach us about social and institutional spaces that they move through, and how this contributes, how their interactions with those institutions contribute to experiences of stress, but also to experiences of resilience. And you'll see in the diagram to the right here that that's really sort of mapping out how the family is its own system that's functioning within a community, that's functioning within this institutional framework. And that's why it was important for us to do this work in Ontario, because we really wanted to look at common family experiences within a common institutional context. So those were the questions that were leading the study. I'm gonna flip to the next one, Joelle.
Okay, so where did we conduct the study? So we decided to conduct the study in 5 major locations in Ontario. The reason why we didn't go outside the province is because healthcare is regulated on a provincial level, and we really wanted to ensure that the perspectives that people were providing was one of reflections based on the current systems in the province. And the 5 locations that we visited were Toronto, which we're based in, London, Ottawa, Kenora, and Brampton. And the rationale of Toronto is that's one of the largest cities in the country, and we're here. Ottawa is the nation's capital, so we had to go and visit, and the diverse range of experiences as well, navigating both French-speaking services, English-speaking services. We wanted to tap into that experience as well. London was an interesting city as well because it's a mid-sized city, and their resources, in some ways, are really resourced. So we wanted to see how are mid-sized cities different from more urban areas like Toronto or Ottawa. Brampton, why we visited Brampton is that they have a high immigrant population, and they had so much diverse range of experiences that we really wanted to see how are families impacted by mental illness, even understanding what is their perspective on mental illness from a cultural humility point of view as well. Kenora, this is why I'm saving Kenora for last, because what really keeps warms all of our hearts is that Kenora reached out to us and they were like, how can we support this project? What can we do? How can we get involved? And, we're all like saying, okay, how can we connect with Kenora? How can we plan it? Because it's such a cool experience. And the fact that they're so open to collaborate, let's make this happen. And I think that's a really important thing to take away, because sometimes there are agencies who don't want to be left out of the dialogue, and they're seeing themselves as, hey, we want to share something, we want to share our perspective, because often our perspective is not included when we're talking about family mental health.
And credit to Stuart for being the driver for that road trip to Kenora.
Yes. Literally the engine for us to make it happen. And we also start off by recruiting and contacting community agencies, but really the first step was connecting with the Canadian mental health associations in those specific cities. And that's because we wanted to connect with organizations that already have roots and have rapport with the community members, have programs with the community members, because we are very mindful that participants will be more open to connect with us if they know that we have some sort of collaboration with a host agency. We're very also mindful to not use the word partnership, but mostly like host agency, because we're mindful of capacities of agencies. So some of the conversations that we had with organizations, specifically like CMHA, was around what's your capacity? We don't want to make this study feel like this is an added program or a burden. How can we help you to make sure that this feels like a collaboration, that you're also gaining something? Because from my own personal experiences working in community, sometimes we'd get these invitations and I'd be like, oh my God, like, do we have capacity? So our team was very mindful of reassuring CMHA and other community agencies that we collaborated with that, we are not here to take up space. We're here to really want to hear from the community members in your town, in your city, in your region. And you'll find ways to give back to your community, give back the findings, engage in that knowledge sharing. So this won't be a one and done type of situation. And what was really interesting too is that from CMHA, local stakeholders then wanting to engage, word of mouth, were all pivotal ways of how people learned about this project. Next slide. So in terms of methodology, we invited people and families affected by mental illness to share their experiences, discuss challenges, strategies, and hopes for themselves and other families. One thing we really were mindful of as well is that families have so much wisdom, and they have a lot of hopes, and they also have a lot of coping strategies. So you really wanted to tap into their complex and nuanced experiences. We included people diagnosed with a mental illness and caregivers in the same gathering. And most programs out there are usually very caregiver specific or people who are living with mental illness. But here's the thing. We all know that our identities are often intersecting, right? So we really wanted to make that at the forefront of our recruitment strategy, letting folks know that we're sharing a space with folks with intersecting roles, intersecting identities. This may feel different, right? But again, it's to capture those very complex, nuanced experiences as a community. And our design of the Family Mental Health Project was based on the World Cafe method, where people with a shared concern are brought together to discuss perspectives on a few carefully chosen questions. These questions were very crafted because we didn't want to create questions that will lead people to give certain responses. There were short questions because we wanted folks to fill in the blanks for us. Some folks had different perspectives on what challenge means, what a hope is, what are good things that are happening. And the following questions that we had participants in a small groups discuss are: when I hear caregiver or care receiver, I think ... When I hear about caregiving family, I think ... And we wanted the participants to define for us, what does a caregiving family mean, rather than us providing them a definition. The other three questions were: what makes caring in families affected by mental illness difficult? What makes caring in families affected by mental illness work well? And last question was: I think the way we can make caring and caregiving work for families is. And that last question allowed us to kind of look at the hopes, the drivers, the things that, policymakers or decision makers are not seeing. And with these questions, it allowed people to really tap into their various experiences in a way that they said often participants in the group that I facilitated were like, we never had an opportunity to even think about these questions in these ways. So this leads to, what do people even think about this? Do people even like coming here? But we met with 67 family members across 5 sites. 67 is such a great number because I feel like that really showed how many people were motivated to share their experiences. And I also remember when I was doing the screening calls, folks would be like, you know what, I want to share my experiences to help somebody else. There were so many people who were motivated to share their story, even though they're at different stages of their caregiving, their lived experiences, the stresses of life. They were going through so many things, but for them, they felt that if they could help one person, rather in person or in the wider community, it was worth for them to participate in this study. And I think that's a key point to take away too, is how can we implement purpose or motivation when developing a project? How can we make a project one where people feel empowered rather than feeling that this is something that's going to cost some labor, right? People woke up early. People woke up really early and stayed for many hours. And honestly, these hours felt like they were 5 minutes, right? Because people were so excited, motivated to have their voices heard. So with these 5 sites, we generated videotaped presentations. Again, thank you so much, Stuart, for capturing the mini interviews, the large World Cafe discussions. We had, as I mentioned, videotaped interviews where people, like after the cafe, was like, oh, I want to say this. Oh, I want to make sure folks can hear this perspective. So these videotaped interviews, again, people are like, oh my gosh, this is another opportunity for me to help somebody else. And we also had audio taped group conversations as well. So moment of truth, what was the feedback? So 88% of people actually would say they would recommend this cafe to others. We heard many participants say they never experienced something like this before. Some participants reflected on, hey, I have never heard from someone who was going through the living with a diagnosis before. Now I can empathize in a different way, right? Folks who had multiple identities were able to reflect on, okay, now I don't feel like I have to fit into a box to access a program or to have my voice heard, right? So, and we really worked hard to kind of really deconstruct these boxes so people felt free to share about their experiences. In the feedback forms, folks mentioned a decreased isolation, a desire to want to keep having these conversations. It's interesting too, and we'll talk more about this later, but even community agencies were really impressed of what was coming out from not just a research point of view, but like a community level point of view. We also found that in the feedback forms, many individuals reported the importance of building connections. 86 people said that they would like to meet again in some capacity. Folks said, can this happen in like a library? Can this happen in a coffee shop? Like, can we have something that this is actually ongoing? And the qualitative feedback portion highlighted the value of just being with others who had similar experiences, sharing resources with each other, hearing perspective of diagnosed individuals, family members, and service providers in the same conversation. And again, these percentages really highlight that there's a high rate of isolation impacting this community. And our project allowed for folks to decrease that isolation, meet other people, and make new connections.
Yeah, and I'll just add to that it was very affirming to hear from people as well, that they appreciated being in a room where, as Joelle said, they didn't have to just sit in a box of I'm the caregiver or I'm the person who has an illness. The other thing is that there were some people like who said, I wasn't sure what this was going to be like when they told me that they were going to have people with diagnoses here as well as people who are identifying as caregivers. And I think that, like I said, it was very affirming that people found that to be a positive experience, that they were able to maybe have conversations or hear things that were harder to do with the person in your family. To hear that from somebody who's talking about their family experience they really valued. And that's actually a really important shift in terms of how we think about what family support might look like, that you could actually have people, all kinds of different stakeholders in such conversations, built around an idea that we are all people who care about each other and are caring for each other. And mental illness is one of the things our family carries in terms of caregiving. So how do we as a family think about that and figure out how we're going to manage all of that? So shifting to the idea of this as a community-based participatory research project. This project was designed, and especially this phase was designed to really use and work with community experience and feedback in terms of how we designed what we were doing, how we recruited, and Joelle can tell you a lot about the recruitment work, and how that itself was a kind of intervention in terms of creating that network and making people aware of each other, as well as making participants aware of what was in the region. And making those connections has really put us in a position of ongoing accountability, right? You don't just come in, do your thing and leave. These are people we have ongoing relationships with now. And certainly that's in terms of sharing whatever's still coming out of the project, but also when they're interested in doing things, also sometimes reaching out to us. Another thing is that we really mixed the range of stakeholders that we were working with, so that we were getting a sense of how we could craft an experience that would be meaningful for service providers, for people who are diagnosed with mental illness, and for people who are service providers. And many of the people we had, especially in Kenora, a lot of people that were peer service providers. So, there was even a range within that identity. So that kind of stakeholder involvement at all stages was very valuable to this. I've already talked about the false divisions of putting people in specific categories, but I do think that in terms of the participatory piece of this, I mean, there's always more you can do to make things even more participatory and involve stakeholders even more broadly. But I feel like, I mean, because there was that sort of early stage and even sort of designing and thinking about like, what do I hope to get out of this project? That was that involved all those stakeholders. And now at the other end, our ongoing work in terms of thinking about what do we want to do with what's coming from the project. But certainly in the experience, I think that another important part of this was that we were really looking at our participants as experts on their experience, right? So there's a way that you can gather people, especially in the context of mental health services, community mental health services, there's a way you can gather people around an idea of support, or we gather people around an idea of like psychoeducation, or there, other kinds of, I think that, things that can feel like deficit-focused programming for families. And I think that part of what they appreciated was we were asking them to be experts on their experience and work with us to be able to pull out something that was going to change not only what they experienced, but what other families experienced, right? So in that sense, I think that was a very important part of the participatory approach, that these were not research subjects. These were consultations with experts on an experience that we wanted to know more about and that we wanted to understand in a deeper way so that we could transform the system. This is the goal, transform the system for families especially. And then the way in which it was action-oriented, as I've already alluded to, there was this already this action in terms of bringing people together, sharing those resources, and doing that in a very localized way. So in London, there were people who didn't even know the CMHA was there, that it just hadn't been on their radar, but we found them in other places. So we, made those kinds of connections. There was the actual connection with other people. I mean, it's very meaningful to me that people said, like, I met somebody here that I want to continue having a relationship with. And then also in terms of leaving things for the agencies that collaborated with us. And we'll talk a bit more about the specifics of that. But a very important part of this project was to develop tools, resources, ideas that could be used by agencies in all of those areas. Yeah, so I think I just said all those things in that sentence. So I will go to the next one. Is this one mine too? No,
So,
that's
oh
oh,
God, just
go
me.
ahead.
So in terms of like, as Charmaine was already speaking to, what are the things that continue beyond the project, right? When we talk about relationship building, it's not just a one-time experience, but it's being mindful that folks wants to stay connected. Participants wanted to know how can we have this in our community, right? How can we replicate this? How can we let others know? Because maybe someone else would have wanted to participate, but due to time constraints or whatnot, they couldn't. And folks were really getting excited on how can we engage the wider community on this very important conversation. So one of the key pieces was around knowledge sharing and building capacity. So we did this through when we had the toolkit, we developed a toolkit. So community agencies were able to replicate the similar model for their own community members. Right, because especially like outside of CMHA, there are many organizations who were very interested in wanting to maybe have this for their own community, like members, their clients, their service users, but didn't know how to start, what materials are needed, how would this look like in practicality. Pieces around social isolation. So as Charmaine already mentioned, many folks wanted to stay connected. People were switching their business cards. The peer support workers in Kenora, even though they knew each other, I felt like certain conversations brought certain individuals closer together in terms of, oh, wow, you actually have this at your site. Okay, let's stay connected for XYZ, right? Folks were able to, like, again, come out of that box, right? And feel very empowered to want to continue these conversations and potential collaborations as well. And as already mentioned, on accessible tools and resources for community members to host their own cafes. That was the toolkit. But I wanted to also add that what we did after, because we knew that people were excited. People wanted, we need to know something. We want a summary of something, anything. People were really excited. So what we did a summary sheet, just talking some key highlights. We did it tailored for each site, where we did a summary sheet on the feedback forums, what people said, what were some key themes that came out from that particular location. And we shared it with the community agencies themselves, and they were free to share it with their own community members. So this was something that we gave in the interim. We made it on Canva, right? It was something that we're like, you know what, we want to listen to the community, what their needs are, what their wants are, and we want them to feel like this is something that's moving forward, and to already show them how their voice is already making a difference. In terms of tools, resources, educational materials, there are so many amazing videos where, again, thank you so much, Stuart, where folks are able to use it for their own educational purposes, using it in a clinical way as psychoeducation, using it as a teaching method. So the ways that we have thought about knowledge translation are ones that support families, healthcare providers, educators, and for the wider public.
So a lot of the resources from this project are hosted on a website called the Family Guide to Mental Health Recovery, which Stuart is the curator of that website. And we have a section in it for the Family Caregiving Project. And some of the resources that are there are the Educator's Guide, which is there to support anyone who's educating healthcare students about experiences of families. A facilitation toolkit so people can host their own family mental health cafes. And I want to mention here that I do think that one of the things that is really a learning from this is that a lot of the work to support families is not just work that's going to happen in agencies that call themselves community mental health agencies, that we need these in other places that reach families, maybe reach families that don't necessarily go to those agencies. So one of the things we were hoping to do was a cafe in Ottawa that was francophone. And then we were also going to do a cafe, there was a request to do a cafe that was just for Black families. So I think that's, a good example of how, you need to have tools to take what people need to the place where they are, right? To places that they trust, to places where they already have social connections, and to facilitate conversations that maybe they haven't really been able to find a way to facilitate. So the facilitation toolkit is to support people in doing that. And, with all of these things, we always say, hey, hit us up. We're happy to talk about it and exchange ideas and maybe even go there. The reason we didn't get to do those other ones was this like COVID virus showed up. Nobody was doing anything, but now we like in honor of that experience, we also have a version of it that you can do online, but it's definitely better in person. It's definitely better in person. We have a YouTube channel that has all of the videos there, and there's a gallery of videos on Stuart's website as well. A discussion guide for community groups to facilitate conversations, and then a workbook for families to do with each other to help them discuss caregiving issues. And really to sort of do reflective work, but also together to plan at times when they are able to do that kind of planning about how they want care to be managed as illness may emerge, or as people get older and they're less able to provide care, as children come into the family. I mean, all of these things. So a workbook to help them work through some of those issues. And and maybe more coming. We really front loaded the public dissemination tools because it was really important to us to get things to the collaborators and to the people who had spent their time and their energy with us. And we're working on academic publications now too. We also have this survey that we posted that really like sort of outlines some of the key findings from the study, and that's across the phases, and sort of asking people to sign on to say that they believe that we need to prioritize the experiences of families in Ontario that are living with mental illness. As you can see, we had a really good week in this picture, which is why we like to we like to show this picture. It was a really good week. And you can see we are really close to getting to 1,500. And that is we want to get to that next goal and send this again, because we did send it already around Family Day, to people in the province so that we can sit down and have a conversation about these issues, because there is a clear advocacy piece associated with this project. I can tell you right now that one of the most important things that we could do for families is to rebuild the network of services that was dissembled in the last two provincial regimes. And that I don't see that this is necessarily an expensive thing. It is something that families are eager to do as peers with each other, and they need some support around that. So we are still on that project, and I'm going to encourage you to go there and help us get to 1,500. Your signature is welcome. So to finish up, we just thought we'd talk about some of the questions that continue with us as we reflect on this project, and maybe questions that we might take into our discussion here. So one of them is, how do we become even more participatory in participatory research? And as I said earlier, I think you can always think about more ways to be more participatory. And I recently did a presentation somewhere else on another project where somebody was saying they think that in no grants, that they think there should be a standard in grants that you have consulted with the stakeholder groups in developing your research questions and your research design. And I think, like that kind of early consultation certainly helped us in doing something that was more feasible and acceptable and useful in the communities we went to. And I think there are other ways that we can think about doing this. I think that certainly the involvement of people with lived experience is another way we could be expanding more, and always more possibilities. A second question, how do we leave the community, or do we even leave the community? Like, what is ethical in terms of when you do participatory research, you build those relationships that are so important. Is there a point where you have essentially left the community? Certainly, I can say that, I mean, we are still here. We're still in dialogue with these people, with a lot of the people that were involved here. For me, it's an ongoing project and an ongoing relationship that goes beyond the SSHRC grant, which ended a while ago, because the issues we're working on haven't gone away, right? So there's always work to be done, and the connections that we make have made have created opportunities for people to say, you know, we're thinking about doing something. Is there a way that maybe we could do this together? And I'm happy to have those opportunities, because any work I do is going to be better if I have the engagement of people who are actually going to be affected by it. And there is a type of, I guess, privilege that I carry as somebody in a university that enables me to strengthen also what they're doing. And then the third question, how do we as a community of people invested in community-based participatory research leverage its strengths into effective methods for making system and structural change? I mean, I've alluded to the fact that we have reached out to the Ontario ministers, deputy minister, as well, around what's come out of our study, our desire to bring them together with families to talk about this issue. And it's been kind of crickets so far. Though I will say that I had, you know, when I did have an opportunity to talk to Carolyn Bennett about it, she was really, really interested. I feel like if we can just get in front of the people, we can do that. But part of what's frustrating is, you know, we do these projects, and I think that they have tremendous strength and weight because they are based on research that has been done with the people who are actually affected. This should be highly compelling to policymakers in terms of, how do I get, what evidence do I need to be able to make changes, or to think about how to transform systems to make things work for people. But it's frustrating that it's hard to get that going. So, you know, I wonder, like, what do policymakers need to hear to actually get families the support they need? And for all of us who are doing community-based participatory research, what are the forms, what are the forums and the venues where we can take this work and say, look, we have got compelling work here. We have stories that you need to hear. We have people that you need to meet. How do we make that happen? So that is who we are, and that is what we have done. We would love to talk about this more. I can, like, you know, leave the questions up if that's helpful as well, but happy to turn it over to questions or comments, and just really grateful for this opportunity. It's wonderful to present about this in an audience full of people that are similarly thinking about community-based research, and I really look forward to hearing your thoughts. I'll stop the presentation.
Wonderful. Yes, thank you so much to both of you. This was an incredible presentation, and exactly the kind of project that we were looking to share, because you're hitting on all points of the process from beginning to end, engaging with the community, spending, mobilizing knowledge that are a benefit to the community, and even as far as the policy changing and the advocacy aspect of your work. So it's just really want to congratulate what you're doing, and we're just so pleased to have an amazing example from you. I'm going to start with a couple of questions, and just want to encourage those that do have questions for Charmaine and Joelle to type them in the chat box, and I will bring them up as and we'll take as much time as we can in the rest of the portion. So both of you were talking a lot about this idea of intersectionality, and how people don't fit into a box, and so I'm curious about how you integrated that with your research. How did you kind of allow for that control from people that you were engaged in your research?
You want to go ahead, Joelle?
Yeah, I would say intersectionality was a way that was, as a framework or as a way of being, was integrated from when the grant was being written, right? For us, it wasn't an afterthought of how can we invite folks with intersecting identities to this project. It wasn't an afterthought or idea way after the grant was approved. We have our recruitment questions, and like, hey, maybe we should think about intersectionality. It wasn't an afterthought. And I think that's really important, because as we're walking with this framework, as is with our way of being, with this intersectionality, our recruitment questions also spoke to this, right? We didn't assume that just because someone messaged or sent us an email saying, you know, I'm a caregiver and I'm interested in participating, we didn't assume or make any assumptions that maybe maybe this is a person who also have lived experience of mental health concerns as well, right? So we're really mindful and ask questions that allow the person to speak to their multiple stories that make up the self. And I think that was very important in the recruitment stage. I'm also being mindful as well, even on our promotional materials, the posters that we made. We were very mindful that to highlight this is for folks who self-identify as caregivers, folks who are living with a diagnosis, and folks who hold both roles. We made sure that was very clear in the promotional material so people can see themselves as potentially participating in this project. So that's what when I'm referring to as intersectionality as the fabric of this project, is that it wasn't an afterthought of something that was planned from way at the beginning.
I'll add to that, and I apologize, I'm on a busy street here, so I hope that's not bothering you. It was an important conceptual foundation of the project too, because I think that, you know, part of why family support as usual, I think, is not working is that it hasn't actually taken into account this intersectionality. So somebody who's diagnosed with a mental illness, you know, the assumption is their caregiving concern is, am I getting enough care? And you know, sometimes there is that concern, but the people with a diagnosis, they're also people who are parents and they're taking care of aging family members, and they're, you know, there's all these things, right? So like the intersectionality of that was an important sort of reset that we wanted to do in the way we're thinking about it. I think another issue is that it's not a literature or a landscape that has really thought a lot about race or sexuality or gender identity, all of these things, not really there. And that was really important too, because the family that a lot of our programming is made for is not, I don't want to say it doesn't exist anymore, but there's a lot of other kinds of families out there. And, you know, so when you sort of put out, you know, a family support group and you say, oh, you know, men don't come to family support groups, I think that's because we don't create an experience that a man sees himself in, right? That's why I think we don't have as many men in those groups. And, you know, that goes double, triple, quadruple for queer families, for racialized families, for newcomer families. I don't think that's been thought through. So I do really want that to be part of what comes out of this, a different way of thinking about who are the stakeholder groups and who are the people we want to benefit through family support, because there's no question that families have to do a lot of supporting.
Yeah, thank you so much for elaborating on that part, because just throughout your presentation, and as you were just saying, it was so foundational to what you're doing. I think some really great transferable learning for all of us to hear from how you approached that. We have a couple of questions from the audience. So I have one question, it's actually two. One was, how was funding secured for this research? And I think you were mentioning earlier it's from SSHRC, but and then the second was, what are the risks associated with this research?
Okay, well, I'll start the funding question. You're right, it was SSHRC, because I intrigued them around the issue of the changing family. And that funding's gone now, but we continue to sort of move forward on it based on little pockets of little money that I find somewhere here and there, because there's so much more to do. So I keep going. So I should express gratitude to the Sandra Rotman Chair in Social Work, which I hold, because that is what's keeping it going now. And then what are the risks of this research? An interesting question. So you even have me thinking about going back to our ethics submission. And, you know, there is, I think, a stigma-laden idea that, like, you know, when I was doing the ethics for it, you know, people are always worried, what are you going to do if somebody gets so emotional? You know, it's like this, like, I think this is stigma. So, but I mean, there's no question we're talking about issues that are very deep, that are sometimes associated with very painful experiences, often multi-generational experiences. But I also know that often people don't get to talk about them. And what's often painful about that is it's not something we're not allowed to talk about. You know, you go to work and you missed a day because you have to take care of your son who's made a suicide attempt. it's not something we can talk about, right? So we want to create spaces where people can talk about this, or talk about what it was like to grow up in a family where this was happening, these kinds of things, right? And I have an ambition around doing children's books about mental illness too. It's Jenna knows I keep talking about it. I want to do it because I think people should be talking about this from grade school, right? Because I know there are children in those families that don't understand what's going on, and people don't know how to talk about this with their kids, right? So I want to do that too. So I feel like I wandered a bit. Okay, so the risks. I think that, yeah, there is no question, like, I suppose, a type of risk, but part of what we build in is supports in the experience. So everybody who was in these cafes were all social workers. And so we were all trained in that way in terms of managing that. But honestly, I think most of what made those supportive experiences was the families speaking to each other, being with people that they shared the same experience with. I mean, maybe the person you asked that question might have some other thoughts on risks that I'd be happy to talk about too.
And just to add as well, I think when we're going through the screening stage of participants, I think there was a concern around visibility, right?
Yeah.
And being seen in the community, and balancing that with, but I want to contribute and I want to like really help somebody else. I feel that what was really important to manage that risk is giving the participants choice of how they want to show up in this project, right? So, for example, there are participants who could have chosen not to be on camera, right? And we would have been able to physically shift the space so that they wouldn't be caught on camera, right? So I think being mindful of visibility and is an important risk to be mindful of. And a response to visibility is options, giving someone options, not yeah, I don't think we could accommodate, sorry, we can't have your voice included. I think giving someone options so they can actually think about all the choices, sleep on it, and get back to you. They could change their mind. Many folks changed their mind when they came to the cafe and said, you know what, I know before I said I wanted to be off to the corner and share my thoughts, but I really want to be participating in these conversations and I don't mind about being visible anymore, right? So honoring that flexibility and adaptability is very important.
And that's an ongoing commitment. Like at every stage of sending out, like when we put new stuff out, especially the video, we sent it to all the participants. So if somebody said to us, you know what, I now that I think about it, I don't want to be, visibly in this, we would take them out of it.
Yeah, thank you so much for that response. Actually, it sounds like you were very conscious of risks that and many different levels, and it just really nurturing the people that were in this experience with you, and just that close connection with relationships and the back and forth. And I like that idea of that one choice that was made earlier, people can change their mind, and there's all these different options of how to be engaged in the process. That kind of leads me to another question I had about your actual research method and how it's so interesting, this theme among community-based research projects, often that the actual research itself has an impact, the process, not just what comes out of it. And love to hear just more thoughts about that. And you were talking quite a bit about and even generated all these toolkits about how you did the research, really, which is your method with the cafes. But it was just interesting how that itself became such a huge part of the impact of your work. Just, yeah, I'd love to hear more thoughts about that.
Yeah, like I feel like when we talk about the methodology, what was really important for us is that the language that we used was very much community-centered, right? Rather than using language that made someone feel that, okay, let me say yes to this poster and feel like I'm going to be analyzed, right? As a team, we really wanted to reflect on, okay, what do we want participants to also get out of this experience? They're spending 3 hours with us, right? 3, 4 hours sometimes, right? What do we want them to, how do we want them to feel, right? If this is an organization that they're used to coming to, right? How can we collaborate with the event host or the director of the organization or the manager of the organization to ensure that the way that we're organizing the space is not triggering for anyone, right? So I think community care was a value that was really woven in the methodology, because we wanted to also express gratitude to all the participants for their time on that Saturday morning, for carving this time out, for sharing their experiences. So we wanted to make sure that how they felt was also being considered through the promotional process, even how we named the Family Mental Health Project, right? Family Mental Health Cafes, right? We use language that helped folks like say, oh, connection, right? Oh, okay, yes, this is a research study, which is in bold. I don't want to minimize that. We didn't want to make this confusion of a therapeutic space, for instance, right? So people were informed on all the materials around this, that this is a research study. But what I think was also very helpful was that the language was very much person-centered, community-centered. So folks knew that this may be a space where they can share their experiences and shift the status quo.
Mhm. I also think that this is a value stance, right? So, when we do human research ethics clearance, they don't ask us about accountability to the participants or reciprocity with the participants, but I kind of think they should. And certainly, I think community-based research does have that ethic. I've seen it most explicitly in Indigenous research now that I've been having more exposure to Indigenous research. But I really think like it's been there's a way you could do this project where you come in, you gather your data, and then you go write your papers. And I want to be real about the fact that I'm in a university and there is an expectation I'm writing papers, right? Um, but fortunately, I'm far enough in my career. Like, what are they really going to do? I don't have the pressure that say somebody earlier in their career does. So I realize that, like, if you're earlier in your career, you might think differently about, how, like, can I front load the public educations instead of the academic? I can do that at my stage. So that's a privilege I can use in that way to do projects that where the accountability and the reciprocity is really important, right? I also think it's something that you think about too. If you think think of yourself as somebody who will continue to live in this town. So I'm continuing to live in this town, in that I'm going to continue to be somebody who is working in this space of mental health in Ontario and beyond Ontario, but in Ontario, in this city, I have ongoing relationships that I want to nurture and take care of in any research project I'm doing. So that's why that accountability and reciprocity has to be so important.
Thanks, Charmaine and Joel. Yeah, and you almost were answering partly your own question about where the end is, and maybe it's not quite clear with those relationships that you've built and that connection to the community. I guess one last question.
I'll just say on that
Charmaine.
point too. Yeah, it's also it can be different forms. So like with this project right now, I am, we're still in like connection with people and talking to people and working on things with people. There's another group. There's a community health center here in Toronto called Women's Health and Women's Hands. I've been doing research with them. It's like weird to say this, but I've been doing research with them for like 20 years. So like we do projects, we finish the project, and then when an opportunity comes up, we connect again, So sometimes those relationships are like it's that they're long relationships. So the project itself might have ended, but the relationship continues and you continue working together. So I think there are different ways to think about your ongoing and enduring connection to the people you do research with.
Yeah, that's really a beautiful way to think. And I think now we're kind of, unfortunately, kind of at the end of this hour. It went by so quickly, and just want to thank again Charmaine and Joelle for the amazing presentation and lively discussion. So as we're bringing the event to a close, we wanted to share that the e-learning events are all recorded, and you can view the recordings on our website under resources, resource section, webinars and discussion. And please stay in touch with us to learn more about CBRCanada events, including upcoming e-learning events, community practice discussions, workshops, and training opportunities, and news from our members. You can sign up to our e-news. I'll share the link in the chat. And please share some feedback about this current webinar and our webinar series in general. We'd love to continue to hear feedback. So thank you again to all of our wonderful guest speakers today, Charmaine and Joelle, and to all of you for participating. And we look forward to seeing you at all of our future events.